I remember the day very well when my husband and I saw the first positive pregnancy test that I ever had, and we were overcome with excitement and joy, and we started dreaming about what our baby was going to look like, what their personality was going to be like, and what life was going to be like as parents, because this was our first. And just 6 days later, I started bleeding and miscarried, and the following weeks were full of different types of emotion and a lot of sadness. And in order to get through it, there's a couple of things that helped me. Number one, it's important for women to understand that miscarriages are common. 1 out of every 5 pregnancies ends in miscarriage. Now, it's not helpful if you talk to someone who's had pregnancy loss before and they write it off because they think that it's something that happens commonly to everyone. But it can be helpful to know that you're not the only one who's experienced that before. And miscarriage is really common. Most of them that do happen in the first trimester. But as time goes on, the chance of miscarrying does go down. So after 12 weeks, it goes down significantly, and especially after 15 weeks, the chance of miscarriage is less than 1%. Another thing that really helped me when I went through my miscarriage is understanding that one of the most common explanations for miscarriage is chromosomal abnormalities. It's basically like things weren't forming right and your body needed a redo and needed a chance to start over and try again. And so it's important to understand that there's nothing that you did to cause it. A lot of women start thinking about what they did in the days to weeks leading up to a miscarriage and wondering if they were the cause of it. Some women may have taken like a warm bath and wondered if that did it, or had a really strenuous exercise workout the day before and wondered if that would have done it. None of that is going to cause a miscarriage. If it's going to happen, it will happen no matter what. And you shouldn't hang that guilt over your head. There's nothing that you could have done to prevent it or to stop it. A lot of women want to know what they can do to decrease their chances of miscarriage. And before I go into that, I want to talk about age. Age is not a modifiable factor, and the older you get, the higher your chance of miscarriage is. So in your 20s, your chance of miscarriage is 9 to 17%. In your 30s, it's about 20%. When you're 40, it's 40%, and when you're 45, it's 80%. So you can see that it goes up significantly with age. There are some factors that you can control that will decrease your chances of miscarrying, although even if you do everything right, unfortunately, sometimes miscarriage still happens. But it's always best to do everything you can. Make sure you start out the pregnancy being as healthy as possible. If you have diabetes, high blood pressure, or thyroid problems, for example, talk with your doctor about the fact that you want to have a baby, and they'll help you make sure that all of your medical conditions are under control and that you're as healthy as possible. It's also good to start out the pregnancy at a normal healthy weight and to maintain a normal healthy weight throughout the pregnancy. Make sure you take a prenatal vitamin each day while you're trying to conceive, because that has folic acid in it and that helps prevent certain types of birth defects. Also think twice about all other medications that you take in your body. So prescriptions, over-the-counter medications, herbal supplements. Talk with your doctor first to make sure they're safe to take while you're pregnant. And if they're not safe to take during pregnancy, you shouldn't take them while you're trying to conceive. So your doctor will help you kind of sift through medications you've been prescribed and help you decide what to take and what not to take. Also, of course, avoid alcohol, tobacco, and illicit street drugs. So these are all things that are within your control. But again, remember that when miscarriage happens, you didn't do anything to cause it. The most common symptoms associated with miscarriage are cramping and bleeding. So if you ever have these symptoms, call your doctor and they'll look into it. Sometimes a miscarriage doesn't have any symptoms associated with it at all. These are called missed miscarriages. This is where a woman goes to her doctor's appointment and the doctor can't find a heartbeat or something like that. That's a missed miscarriage. The woman's body hasn't done anything to try to expel the contents of the pregnancy. On the other end of things, if you're cramping and bleeding, it doesn't necessarily mean that you're miscarrying. 20 to 40% of women experience vaginal bleeding during the first trimester, and some of those do go on to have healthy pregnancies. So your doctor will look into reasons behind the bleeding and cramping and decide if anything needs to be done about it. If they've determined that you truly have had a miscarriage, which is diagnosed by doing a pelvic exam and an ultrasound, treatment from there on out is going to depend on your circumstances. If you've already started cramping and bleeding, They'll probably just give it a couple of days to see if your body will spontaneously expel all of the contents of the pregnancy. But if you've had prolonged bleeding, or it's abnormally heavy, or you weren't bleeding or cramping at all, like it was a missed miscarriage, then medication or surgery might be necessary. The surgery that's done is called a D&C. It stands for dilation and curettage, and it's where you're under general anesthesia. The doctor dilates the cervix to gain access to the uterus and then scrapes the uterine wall to get all the contents of the pregnancy out. And this allows your body to heal. Not only does your body have to heal physically, but you need to heal emotionally after having a pregnancy loss. It doesn't matter if you're 5 weeks along or 15 weeks along or even beyond. When you have a pregnancy loss, you still experienced a loss. And if it happens early on and you don't actually have your baby to mourn over, you're still mourning the loss of dreams and hopes that you had during that time when you were pregnant. And you need to allow yourself to go through all the stages of grieving. And the first stage is denial. The second stage is anger. The third stage is bargaining. The fourth stage is depression. And if you don't allow yourself to go through all of these, you might get stuck in one and become bitter and never get to the point where you can accept it. And I don't know that you ever move on from it either. You just have accepted it and you're able to move on with your life, but you still have that memory of what it was for you. I think one of the best things you can do for a miscarriage is talk to people. Talk to close family and friends about what you're experiencing. And I don't think it's good to go out and share with the whole world that you're pregnant once you find out, but I think it is good to tell a couple of close friends and family, because then if you do have a miscarriage, you have someone to turn to. You feel like someone can sit down with you and the world stops for you when you have a miscarriage, and someone can be there for you so you don't feel like the entire world is just callously swirling around you while you go through this. There's also support groups for women who have had pregnancy loss. You can look those up in your community. Talk to family and friends who might have had a miscarriage in the past, because you can gain a lot of hope from seeing how they got through their trial, and ultimately if they went on to have another baby, that will bring you hope too. Look to the future, and when you get pregnant again, try not to look back and think that every single pregnancy is going to end that way. After a miscarriage, a lot of women want to know when they can try again to have another baby, and for a lot of women, this is how they feel like they'll get over the fact that they miscarried, is getting pregnant again. So they want to get pregnant as soon as possible. But most doctors recommend having at least 2 or 3 cycles before you try again. After a miscarriage, you might notice that it takes a month or 2 for your period to return and for you to have regular cycles. And if you've had a couple of them, then you're probably okay to start trying again. But everyone's circumstance is different, and it kind of depends on how far along you got. So I do recommend talking with your doctor about when they feel like it would be right for you to start trying again. And I also feel that it's important to have accepted the fact you had a miscarriage and to be healed emotionally before you get pregnant again. If you have any questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.